Hey guys, it's Lori back with another video. Let's talk about what to expect before getting approved or getting the spinal cord stimulator surgery. Of course, I wrote down notes. There's a slew of tests that you have to go through. It's been a while since I had mine, so I'm just going to write down what I remember. It might not be the same for everybody, but majority-wise, they do a bunch of tests, and it's for the right reasons. They want to make sure that you will cope well, your body is good enough and good enough shape, at least for this type of surgery. And you know, they're just dotting their I's and crossing their T's. So obviously the first thing would be blood work, a ton of blood work, just to look at everything. X-rays, MRI, CT scans. I guess they just want to make sure everything is strong in there and okay for surgery. I remember heart tests, EKG, maybe a stress test. I know I had a stress test, but I don't know if it was for the surgery, so do your own research. Another thing was if you have bleeding problems or take blood thinners and bleed too much, that's an issue, and they won't give you surgery for that. And another thing was, I looked this up. If you have a curved spine, it might be difficult to place the stimulator. So the only issue I had was my diabetes. At that time, I had just gotten diagnosed, so I was still trying to control my sugar levels. So my numbers, again, went to get blood work again, and my sugar numbers were too high. So they literally canceled my surgery because my sugar levels were high. I mean, looking back, I understand that they were just doing it for my own good. But I remember being so overwhelmed and shocked because I had my surgery date set. Okay, so I was prepared at home. I had my bag packed. I was mentally preparing myself. And then another thing that happened in my blood tests, my liver enzymes came back extremely high, and they had no idea why. And then just accidentally, when I was in the PCP office, one of the doctors, my nurse or my doctor, went and talked to another doctor to see if he had any idea what would raise enzyme levels so high, like mine were so high. And they eventually figured out that it was because a cholesterol medication I was on was affecting my enzymes. And so I was very relieved that they came up with that, because I think I also got a liver ultrasound. I don't even know if I'm saying that right, but I had to get an ultrasound on my liver because after they seen the enzymes were so high, they needed to make sure I wasn't having some liver issues. Anyways, after that, I'm trying to think if there's any other tests. There could be. You know, every case is different. So my issue was diabetes. So if you have diabetes and you're about to get this, make sure your numbers are controlled. And this is probably, I don't want to say most important, but this is a very important part of it. You have to see a psychiatrist, okay? Even if you have your own, you have to see another one. It's either one of theirs or you pick from someone. I can't remember, but I had to go see a psychiatrist. And the purpose of that is to make sure that your mental health is in the right place and you're ready for the surgery. Okay, they want to make sure that you understand the magnitude of this major surgery and what you're about to go through. You know, something of this magnitude, they need to make sure. So I think I had 3 or 4 visits with a psychiatrist. And you know, I was honest about my own mental health issues, um, and you know, I think we just had conversations, and he took notes, and I think he understood, like, okay, this girl's been through a lot. He knew my whole history. She's ready for this, you know, even if it doesn't go well or it's unsuccessful, she needs to know. I needed to know that if I had the surgery, I needed to know one way or another. If I don't get the surgery, or if the surgery is a success, wonderful. If it's not, then at least I know, and I don't go living life wondering, should I have gotten that spinal cord stimulator? So yes, there is a lot to go through to get this. And it's for good reason. It's for your own good. It's for your body. They want to make sure they can cut your spine open, okay? Insert electrical leads, and then open up your hip and put a battery pack in. This is a big deal. And the other thing, the last thing is that before all this can occur, or maybe after the testing, before the surgery, but after the testing, you have to get a trial stimulator for 7 to 10 days. And I had that. You go, they put it in, and you can feel it. It's a little painful, I'm not going to lie. But you hold that in, you keep that in for 7 to 10 days. It's just a mini version, really, of what you're going to be feeling. And what they ask you is, what was the percentage that you would give that this trial stimulator helped you? And honestly, I can't remember the percentage I gave, because I was unsure. You know, I had doubts, you know, just like all the other tests and stuff that came back and didn't help. I had doubts, but I wanted to be honest because I felt like it was kind of helping. But psychologically, I don't know if it was or I wanted it to be. So it was on the low percentage. There was a percentage number, it wasn't like 0 to 100. It was smaller, probably like 30 to 80, whatever percent. So mine was low, but it was high enough to where they would do the surgery, that they thought it was worth doing the surgery, because of the results of the trial stimulator. So please remember that if you're going to try to get this stimulator, there's a lot of tests. You know, just do what you need to do what the doctors tell you, get the test. The faster you do it, the faster you can get your surgery date. Make sure you do the trial and make sure you're honest. You know, I don't regret doing the trial or doing the surgery because, like I said, I would have thought for the rest of my life, would that have worked for me? Would that have been my lifesaver? So, you know, everybody's different. We're all different. If you feel like it's worth a chance, you know, for the surgery, and that you might regret not getting it, because this surgery helps so many people. I always say, just because mine wasn't successful and mine didn't help at all, doesn't mean yours won't. There's so many successful stories for this. It's just that whatever is wrong with me, being undiagnosed, apparently nothing helps. And I hate to laugh about that, but I've been through so many things that we're almost starting over with me because I'm starting to get injections again, and I had at least 30 injections years ago, and then we just stopped because none of them worked. So we are kind of slowly restarting with trigger points in my back. They did not help, but I know that we can try other stuff, and hopefully if I show that I'm willing to, you know, try anything, maybe my medications can be changed, but I don't think so. My pain doctor's he's set in his ways, but he's also protecting himself, so he doesn't want to keep throwing medications at me that will be a red flag to the government. Unfortunately, we live in this day and age where, you know, people in pain or any kind of illness that requires pain management, we're questioned. You know, because there's a lot of people, there's a lot of addicts out there, you know, and they have their problems. You know, it's not about hating them. It's not their fault. They have problems of their own. It's just that it's hard for us in pain to be treated seriously all the time, because the doctors that write the prescriptions, they could get in a lot of trouble. They can lose their medical license. So I'm going to end it there, and I just want to say thank you again. If you're watching this, I hope it helps you. If you have any questions that I might be able to answer, put them down in the comments, and I'd love to hear from you. Okay, have a great day.